Challenges are necessary. We need them in order to grow. You don't have a challenge, you don't grow. Um,
Challenges, they are commonplace everywhere, especially in healthcare. And sonographers are no strangers to the different challenges that can come along with patient care. Today, we'll be talking about how sonographers can face challenges, or as our guest Tristan likes to call them, technically difficult situations, with success. Tristan is the imaging manager at CHI St. Luke's Health and is also passionate about teaching others. He is a clinical instructor at Cardiotech Ultrasound School and has been practicing sonography for 12 years. Recently, Tristan wrote an article entitled Beyond Technically Difficult Studies, where he discussed how sonographers can tackle various issues they could encounter in their work. So, Tristan, thank you for being here today.
Thank you for having me.
In your article, you mention an area of difficulty that I'm sure every sonographer can relate to, and every professional really, but especially if you work in healthcare, and that's time management. Especially when you're a new sonographer, new clinician, I can imagine that it feels like you're being thrown into the deep that first time that you're asked to just take care of the patients alone. And you kind of also touched on how imposter syndrome can easily kick in during those situations. And that, of course, ends up adding to the pressure. And you also have to manage the caseload, keep up with the volume. And naturally, that's no easy task, especially again, for someone who's new. So, could you tell us how you overcame that hurdle of time management and what key piece of advice you would give to newer sonographers?
Sonographers, our jobs are very complex. There's so many parts to it. There is the technical aspect of you knowing what to do, when to do it. There's a clinical aspect of you understanding what you're looking at. And then there's the patient care aspect of you actually meeting someone for the first time and being that healthcare provider for them in that moment.
Right.
Now, as a new sonographer, fresh out of school, these challenges are even more amplified because
Of
there's
course.
a high level of uncertainty of your own skill set, as you mentioned, of what you're doing. And it feels sometimes as if you're not sure how to navigate. I remember my first echo interview. It was actually in Jamaica where I grew up. So after I got done with school here, I went back there and I interviewed, and it took me 90 minutes to do the the echocardiogram on
Wow.
the
Wow.
interview scan, and I remember feeling just so defeated.
Hmm.
Fast forward a couple months later, I was promoted to lead for that organization because
Sure.
I had figured out how to manage my time. So the tips I would give to new sonographers are two of them actually. One is lean on the people that you already have. Hopefully, you're in an environment
Mm.
where you can learn from the team that's there. You have good preceptors, people who would kind of show you the ropes and help you understand how the system works, how the hospital works, what's the easiest route to get to here, how do you handle outpatients, how do you handle when a patient needs to use the restroom in the middle of your study. And
Yeah.
also, you have to invest in your own education as far as if you see something you didn't think you did a good job at it, follow up on that exam to see what the cardiologist think. How did the sonographer before you approach the case? What's best practices? How do you actually do this successfully? And then your confidence will build. You will start becoming more familiar with the equipment that you're using. You will know where the buttons are, how to change this, how to optimize. And then as soon as these things start clicking, then with time, you will definitely be able to manage your own time better and be a more productive member of your team.
Excellent. Yeah, that component of mentorship, I know that you mentioned in the article, that must be so important. You even though you go through the training, the schooling, then when you have the hands-on experience, I mean, you have to have someone by your side. So that's just so great for sonographers to keep in mind, especially when they're picking a facility to work at.
Yes,
Yeah.
absolutely.
And I also really loved in the article how you talked or you dedicated a whole section really to navigating the workplace.
Yes.
And you described the perfect world where basically everyone gets along and all the stakeholders are happy. But the truth is that even in the best healthcare facility with the best team, there's bound to be disagreements and the occasional contention
Mhm.
between clinicians or between clinicians and admins. I mean, it's just human nature. So, what key piece of advice would you give to sonographers in leadership when it comes to handling disagreements in the workplace? Because, of course, at the individual contributor level, when you're just the sonographer, that's important too. But now, when you're leading a team of sonographers and they have disagreements among themselves or disagreements between teams, what's the key piece of advice that you would give, especially between other departments and admins?
This is a question I get asked very frequently. And at this facility, I feel like I grew up here. I was a
Mm,
medical student, and I was a technologist one, technologist two, then lead, and then now the imaging manager for non-invasive cardiology. So I really grew up here, and what I learned transitioning from lead to manager, from a sonographer to a manager, um, it's that your set of skills that would make you a great sonographer, your ability to produce great images, to assess a case really well, to provide good preliminary interpretation, do not translate over to management or leadership. It's a whole different
mm,
set of skills that you're now being measured by. And one big main point is conflict resolution.
wow.
The main, I guess I could divide it in 2 points. My main point would be to gain control of yourself. Know thyself.
Mm, yeah.
Know what your triggers are. Know how, if there's a difficult situation, what you need to do in order to return to baseline. We're all
Yeah.
human. We all have different triggers, different things that make us unhappy. Maybe we feel disrespected by what somebody said or did. Maybe we feel betrayed, lied to, whatever the situation is. But you have to always remain in the driver's seat with your own emotion. If
Yeah.
not, anything that happens after you've gotten to that level is not going to be the thing that you would have wanted to do. So gain control of yourself. And the second thing is, don't take it personal. You never know what a person may be going through.
Wow.
This applies to patient care. Like, you may walk into a room and for some reason the patient just doesn't want you to see them today, or
Yeah.
they're in a bad mood.
Yeah.
They probably received bad news. It is not about you at all. So if you could do these things, of course, I could list maybe 10 or 20 steps that you have to follow to be
Yeah.
successful at this. But if you could gain control of yourself and then also recognize that 99% of the time it's not about you at all. That person that may be just having a bad day or experiencing or fighting something that you have no idea about.
Yeah, that's so important, especially the part with the patients, because if you're a dedicated clinician and a
Yes.
sonographer, it's very hard to not take it personal. When the patient doesn't respond the way that you wish they did, you have
Yes.
your own stress. So important to do that then without losing that warmth that you want to show as a practitioner. And so there's such a balance between both. Really good advice. And then lastly, you mentioned in the article the pandemic, which of course that was a very difficult situation, especially for any practitioner working in a hospital. It was
Yes.
really hard. And we're all familiar with how burnout, unfortunately, did become a far too commonplace in healthcare
Mhm.
during the pandemic. And in some cases, many practitioners might still feel burnt out. Some have even left healthcare as a whole, unfortunately. So, from your position in leadership, what advice would you give to sonographers so that they can avoid burnout, especially new ones who feel like, man, I just started and I'm already tired? And what are some ways that sonography leaders themselves can really minimize that risk of burnout on their team, especially again in a hospital context or in a high volume facility where stress is sadly too common? What would you say?
I would start out by saying never lose focus or sight of your why you began in the first place.
Mm,
Did you
yeah,
have a passion that you're trying to live out? Are you heading somewhere? What does your life look like in 5 years? Who is that person? What does that person do? You then start to see things instead of the now, you see further down the road.
Yeah.
So you are more likely to make whatever adjustments you need in order to get there. You're reminded, okay, especially during the pandemic, we were scared just like everybody else. We didn't understand
Yeah.
what was happening, but I knew that I needed to be here for the patients. I needed to be here for my team. I was going up to the COVID rooms just like my whole team. We were
Yeah.
all writing it out together.
Yeah. Yeah.
So keeping your why in focus, and it's so easy when there's so much noise to kind of find the music. But if
Yeah.
you could really focus on why you're doing this in the first place. Now, if you don't have a why, I can understand it would be easy for you to get discouraged when
Yeah.
things aren't good, because things are good when they're good, but when they're not good, then what? What do you have to
Right.
fall back on? Then the other thing that I would say is self-care, and this is something I had to learn recently.
Mm.
I'm the type of person that will stay in the office. I'll be the first one here and the last one to leave.
Mm. Yeah.
But you have to remember that while you may feel like a superhero, which we are, you're a human being. You get
Right.
tired. You need sleep. You need exercise. You need fresh air. You need
Yeah.
a vacation. You need a massage. You need to talk to somebody.
Yeah.
I remember having a very difficult case where this was a patient who postpartum went brain dead because of complications, and the family had to make a decision to withdraw care. And that was terrible. I wept with the family while I was doing the echo.
Yeah.
So you have to talk to somebody about that
Yeah.
to
Yeah.
figure a way how to channel that energy somewhere else and to
Mm.
to recenter yourself. So self-care is very important, and just keep your why right here. Always remember why you're here, why you're
Yeah.
here, why you're here, and then things will be much simpler. It won't be solved completely, but
Yeah.
it'll be easier to make the right choice.
Yeah, there's always going to be challenges. I mean, that's something we can expect, but that's such an important thing to keep in mind is the why. And I think it's very easy, unfortunately, in those situations to lose sight of why
Yes.
it is, that we're doing what we're doing. And as practitioners, it's just essential to continue keeping that at the forefront. Because
It
if not, it
is.
can be very easy to think, man, why did I get into this? But there's a reason. There's a reason. It's just one has to kind of keep
Yes.
dwelling on it over and over again, especially like you said, in those tough situations, and also to reflect, on the good, aspects um, of the work that's being done, of the good cases. I'm sure you have stories of success stories that you've had and your team has had, and it's
Oh,
so
so
important in
many.
those situations, right? So much to think about them, because if not, yes, it does become very easy to forget about it and to get that burnout. Yeah,
It does. It does. It
yeah,
does. Challenges are necessary. We need them in order to grow. You don't have a challenge, you don't grow.
right.
I think sometimes we've been programmed to avoid challenges at all
Mm,
costs. We give up when it gets hard, but sometimes when it gets hard is when you learn the most. When you feel most like you don't know what's happening. It opens up. I always tell people whenever I'm asked to give a talk, I have several myocardial infarctions while preparing for the talk.
right.
'Cause I, I suddenly start thinking about all the things that I don't know about the topic, but
Mm,
it is that feeling of, oh, I need to get all the information I need so I don't make a fool of myself, that keeps me pulled up, that keeps me digging, researching, to make sure that whenever I stand before an audience, I know what I'm saying.
yeah, that's great. Well, this has been such an interesting and encouraging conversation. I mean, I think it can definitely serve as encouragement to a lot of the sonographers who are watching this. So thank you for all of your advice and for your time again, Tristan.
Thank you for having me. This was fun.